Good Monday afternoon. I'm Dr. Martha Buchanan, Director and Health Officer here at Knox County Health Department. Our moment of gratitude today is dedicated to the people and organizations that are providing critical outreach to those in our community whose first language is not English. Just last week, thanks to several of these individuals, we were able to film 13 videos in a total of 5 languages, with another 4 videos that will be filmed this week. We are grateful for the support of these organizations, for the support these organizations provide to our community, and we appreciate their partnership as we try to expand our outreach. Now I'd like to spend a few minutes talking about testing. This week, we'll continue testing at the main health department here, 140 Dameron Avenue, Monday, Wednesday, and Friday, 8 a.m. to noon. No appointments are necessary. Wait times can be long, so be prepared for that. While our testing is at no cost to the individual, the lab bills insurance or Knox County Health Department for the cost of those tests. And because we learned the funding we got last week, the $7.1 million, that funding is limited and can't be used to pay for testing for insured individuals. We've begun collecting insurance information again from people getting tested. They will still not pay for anything, but their insurance will be billed by the lab. This is slowing our process down a bit. So again, be patient as you wait. This week we've also made another change. We've started using a different lab, hoping that we'll have faster turnaround times. So lots of changes happening with our labs. If you do get tested, we continue to ask that you stay home until your test result comes back. If your test result comes back positive, you can expect a call from us. We will ask you a series of questions about where you've been and who you've been around. This is standard contact tracing procedure and helps us identify any close contacts you have who could have been exposed. This information is private, and we do not share your name with any of your contacts. We know it can be scary to hear news of a positive test result and then have to answer a whole bunch of questions. We simply ask you to please be honest and respectful to our team, as they are just doing their jobs and trying to prevent the further spread of this disease in our community. In regard to close contacts, if you get a call from us saying you were close contact to a confirmed case, you will need to quarantine for 14 days after your last contact with that case. You cannot test your way out of quarantine, meaning that even if you get tested and your test comes back negative during that 14-day period, you don't get to get out of quarantine because it's counted 14 days since your last contact. And the reason for that is the incubation period for COVID-19 is up to 14 days. So you could test negative today, and on, say, today's day 9, and on day 10, you can be positive. So that can happen. We've seen it happen. So you can't test your way out of quarantine. That means you can't get a negative test and go back to work, can't get a negative test to go back to practice or school or anything else. Now we'll move into the local situation. We have 3,205 confirmed cases of COVID-19 in Knox County. Additionally, we have 140 probable cases. 1,332 of our cases have recovered, giving us 1,847 active cases. 193 individuals have been hospitalized at some point in their illness. 45 Knox County residents are currently hospitalized. We are saddened to report 3 additional deaths related to COVID-19, bringing our total to 26. Our thoughts and prayers are with the loved ones and family of these individuals. As a reminder, the Board of Health's next meeting is this week on Wednesday, 5 p.m. The public can view the meeting live on the Knox County YouTube channel or the main Knox County website. And now I'll open it up for questions.
All right, the first question we have is from Alan Sims with Inside Knoxville. He says, I've heard reports of cases on local high school football teams. Have there been cases and how many?
As you know, we don't comment on specifics about cases or clusters unless we need to do that for the public to take action. So we've had clusters in many places, but we don't comment on specific clusters unless there's a public health reason to do so.
His follow-up question is, given that social distancing and masking is impossible on a football field, is it safe to have football?
The TSSAA has made really recommendations for regular screening, temp checks, symptom screening for everybody, coaches, players, and everybody else. Also recommending wearing of masks when possible and social distancing as much as possible when off the field.
Also from Alan with Inside Knoxville, when deaths are reported on a given day, are they added to the graph on the website for that day, or might they be represented deaths from each of the last several days and be spread across the graph accordingly?
So when we put them on the graph, we'll be putting them on there based on the day of death, the day that the person departed. The ones we report out are reported out as we learn about them, and then we go back and look and see that that person maybe died earlier, but we are just learning about it now, but it'll be on the graph on the day they passed away.
From Megan with WVLT, a viewer would like to know how positive cases are counted. For example, if one individual was tested 3 times and received a positive result, would that cause the case count to rise by 3?
Here, Knox County counts that as one case. There's some questions about that. So we know that individuals shed dead virus for several weeks after they recover. So you get sick and you test positive. What we test then that's live virus. You can make other people sick. That's why we put cases in isolation until they've either been in isolation for 10 days or at least 24 hours of feeling better, plus 10 days. So after that, the virus they shed can't make other people sick and isn't making them sick. So we've actually sent the question up to the state, how long after somebody's initially positive before we would count them as a new case again? Because we know people shed virus for several weeks. Right now, we are not counting them as a case unless they have new symptoms or some change.
Also from Megan with WVLT, is the data showing any effect on cases due to the mask mandate?
I think it's too early to tell. I think we'll have to continue to watch the data. So what we know about COVID-19 and testing and all of that stuff, COVID-19 has an incubation period of about 14 days. So we've got that lag time. People have to get sick and then decide to go get tested. So we've got that lag time. And then we also have just the lab lag time. So when we're working an infectious disease, we really want 2 full incubation periods before we can say things are kind of settling down. We're right at that point. So I think if we're going to start seeing effects from the mask mandate, we're going to see them this week.
From Cole with WBIR, can you give us information on the ages of the people who died from COVID since Friday's briefing?
Sure. 68-year-old female, a 74-year-old male, and a 43-year-old male.
And we had an additional death over the weekend that we'll work to get you the age and the sex of. From Megan with WBLT, how long does it take for deaths to appear in the official data? Did the 3 new deaths occur over the weekend, or could they have occurred days or weeks earlier? I think Dr. B just spoke to that. Is there anything else that you want to add?
Yeah, I mean, I think they're reported from different sources. So sometimes it's the person dies and they have an autopsy and the test is collected at that time, and then we get that test result eventually. Sometimes the person is in the hospital and we already know they have COVID and we get that sooner. So it kind of depends on the source of where it's reported from.
From Cole with WBIR, 21 of the 26 COVID deaths happened in July. Case numbers are still going up. Is this just another sign that people are not taking COVID seriously? And what do you say to those people?
Well, I think a lot of people in our community are taking COVID seriously, but I think a lot of people still aren't. I would agree with that. I think we've seen an uptick in cases, and we know what causes people to get COVID. We know that close contact and exposure to a case is how people get COVID. We know that. So the 5 basic principles are really about keeping your distance, reducing risk, and reducing spread. And when people don't do those, we're going to see more cases. So I'm hopeful that people will look at this data, take the mask mandate seriously, start practicing the 5 basic principles everywhere, at work, at home, in public. It's not optional. You don't get to do it when you choose. Because if you do it when you choose, it's not going to work. If everybody is treating it like it's optional in some situations, it won't work for the whole community. So we have to do it. It's, like if you're trying to lose weight, and you just diet when you're at work and you don't pay attention to your diet at home, at home or in social gatherings, it's not going to work very well. Same thing happens with this. If you don't let your guard down, understand that COVID-19 can be anywhere in the community, and even that person you know really well, who wouldn't do you harm, could accidentally make you sick, or you could accidentally make them sick. So you don't want to do that.
Also from Cole with WBIR, we know it takes time for the virus to spread, infect people, make them seriously ill, and eventually lead to their death. Do you have any information on how long it typically takes from a patient contracting COVID to their death?
That can vary. I actually don't have that data. That the hospitals would have more of that information than I do, but I don't have that information. But what we do know is it takes some time before people decide to go seek medical care. I believe that's actually Charity's writing me a note.
3 to 4 weeks.
Takes about
Probably in total when you look at it.
3 to 4 weeks, probably in total. But some people will get sick and die, unfortunately, really quickly with this disease as well.
From Vincent with the Sentinel, many service workers cannot afford to take 14 days off, and enhanced UI support ends at the end of the month. Do you recommend that employers offer PTO for people in quarantine?
We've been recommending that employers look at their leave policies during the whole pandemic from the very beginning. And yes, employers need to look at their leave policies, make sure they enable their staff to be able to be home and be able to support themselves, because even if they're not working, they still have to pay their bills, they have to pay the rent. So we do recommend that employers support folks who have to be in quarantine.
Also from Vincent with the Sentinel, are you concerned that the mandatory quarantining in the absence of PTO might discourage low-income people from cooperating with KCHD's contact tracers?
We've certainly seen some of that. It is a real challenge. What I also will say is we have a really great group that the Emergency Operations Center has convened of different community partners that are helping us out and helping those families and individuals out with rent, groceries, et cetera, when it's needed. So we've been able to identify those needs and get them met so that people can stay in quarantine or in isolation. It's something we sometimes have to do with TB patients year round. So it's something we've done in the past. We're grateful for this community group who's helping, because right now we're really working the response and the contact tracing and case investigation piece. So we're happy for that extension.
From Cole with WBIR, what is KCHD's recommendation for people while they are awaiting a test result? Should they go to work? Should they be out and about? Or does that answer vary based on whether they have symptoms or known exposure?
Actually, no. Right now, we're recommending, and it was in the Board of Health's recommendations last week, that regardless of your symptoms, if you get tested for COVID-19, we want you to stay home. We know there's asymptomatic and pre-symptomatic spread. So if you are concerned enough that you might have COVID-19, that you get tested, we want you to stay home until you get that test result back.
From Vincent with the Sentinel, do you have any updates on alternate testing sites? KCHD has been seeking a solution to long wait times in the heat.
We are hopeful that will be worked out this week. We continue to work out the logistics of that. We'll have more information as soon as we have it for you.
Also from Vincent with the Sentinel, last week the board did not discuss the federal recommendations for counties like Knox. Will that be on the agenda for this week?
I believe if you look at the agenda, I believe it's on there. I looked at it earlier today, but so I think it is an agenda item. That agenda is available publicly on our website.
From Megan with WBLT, KCHD is outsourcing for help with contact tracing, correct?
We currently are, that's just so a couple things. Contact tracing, we're hiring folks to help us with contact tracing. And then contact and case monitoring is being done by the state of Tennessee Department of Health. They're also helping with contact tracing.
And Megan's follow-up question is KCHD staff being overwhelmed by the recent increases in cases?
We have been able to keep up with contacting all of our cases within 24 hours and contacts within 48 hours. We're working really hard. We're working 7 days a week and long hours. So adding these additional staff to be able to let some of our staff go back to doing some of the things we normally do. We've got back to school rush coming up, so we're going to have to vaccinate children to go back to school. We've got some other things we need to do. So having those staff come in, our staff will continue to work the response just in a fewer hours per week, so they can do other stuff in those other hours.
From Cole with WBIR, has KCHD seen people who have infected, exposed others while they were supposed to be quarantining or isolating, awaiting test results?
I do not have the answer to that question because I'm not doing contact tracing and case investigation. So I honestly can't answer that question because I don't know. I'm sure it's a potential. That's why we want you to stay home.
From Megan with WBLT, can you talk about the $7 million grant KCHD will receive and the role it will play in helping fight the virus?
Sure. So that $7 million grant is from the epidemiology and lab capacity division of at the federal level. So it's a very specific focus. It's focused on increasing our lab testing capacity and our ability to do contact tracing and control the disease. So that money will be used to pay for the testing that's done. One of the limitations to that money is that it can't be used to pay for testing for insured individuals. That was a surprise for us to find that out. So we've had to change some of our process. We're looking at other options. It will also be used to hire the folks that we're going to be hiring to do contact tracing and case investigation and testing, PPE and other things that we need. It's not CARES money. It's different money. It comes from a different division at the federal level. It did pass through the state, but it is not CARES money. To date, Knox County Health Department hasn't received any CARES funding from TDH.
From Vincent with the Sentinel, he says, can you put me in touch with those community groups? I asked last week for something similar and there wasn't a follow-up.
Sorry about that. We'll have to check with them if they're okay. Share it with us, sharing their information with you.
From Cole with WBIR, when does Kchd expect to be up and running with its new lab provider?
We started today with a new lab provider, and that's another thing. The process with that new lab provider is different than it was with the old lab provider. And so that's slowing us down a little bit today because we're having to learn a new process.
Also from Cole with WBIR, he says, apologies because we've asked this before. When people are listed as COVID-19 deaths in Knox County, does that mean they died of complications due to COVID? Or could someone who dies in a car crash but tested positive be counted in those numbers?
We are not determining that classification. That's being determined either by the provider who saw the patient or perhaps by the medical examiner's office. So they report to us. We don't make that determination.
From Megan with WBLT, a viewer would like to know if any special measures are being taken to catch positive cases in kids and teachers at Knox County schools.
Yeah, that's and you certainly can ask the schools about that, but they're employing the 5 basic principles in the reopening. And just like any other business or employer, they're screening and taking temperatures and all the things that we're asking everyone else to do as well.
Let's see, from Vincent with the Sentinel, what specific recommendations is the board considering for Wednesday? He says he's asking about the agenda item entitled Local Bars, Review and Discussion Possible Action. So he's asking what possible actions?
Great question. That'll be something the board will discuss and decide.
From Megan with WVLT, she says this comes from a viewer. Is there any way to request a mask online and have it sent to your home for free?
I'm sorry, we're not able to do that.
Any other questions? Please go ahead and type them into the chat feature now. All right, not seeing any other questions come in. Thank you all for joining us, and we will see you again on Wednesday at the same time. Have a good